Maggie is a young nurse with a successful career at a private hospital. She has been working in this hospital ever since she left nursing school 1.5 years ago. She has had 2 promotions in the past year, and everyone is happy with her performance. Her mother had been living alone but was experiencing difficulties due to advanced age. Maggie made up her mind to live with her mother. She decided to move to a bigger house and hire a home caregiver to help look after her mother. To cater for the additional cost, Maggie had to start taking up more shifts. This meant taking shifts back to back and sacrificing sleep. Everything worked out perfectly at first. Soon, however, her patients and colleagues started complaining about her sloppiness, tardiness, and rudeness to them. The nurse managers overlooked it because her performance in the past was very impressive. At one point, however, she was found to have administered the wrong medication to a patient, and that resulted in a medical emergency. She was suspended for 6 months and later demoted. To Maggie, it made sense to sacrifice a few hours of sleep for the extra cash. However, this negatively affected her performance and created even bigger problems for her. Sleep plays a critical role in ensuring that body organs such as brain function optimally. Unfortunately, it has been associated with laziness, which makes it considered unnecessary. Studies show that sleep increases attention, creativity, learning, memory, and helps in decision making. I will first talk to you about how much sleep one should get, then look at the effects of not getting enough, and finally how we can conveniently increase the amount of time spent sleeping. First, we'll begin with the amount of sleep needed in a day depending on a person's age and how crucial it is to sleep within the recommended range of hours. According to National Sleep Foundation, the amount of sleep required depends on a person's age. Young adults between 18 to 25 and adults between 26 and 64 should have at least 7 to 9 hours of sleep. Older adults above 65 should sleep 7 to 8 hours. According to the Journal of the American Heart Association, one should sleep within the recommended range of hours. Sleeping less or more hours than is recommended has been associated with cardiovascular disease and mortality. The focus should be on getting quality sleep within the recommended duration. In these recent times, sleeping problems have become a more common occurrence due to one small object, the phone. Based on studies from Harvard, there are multiple reasons why people should start putting their phones down at least 1 hour before they begin falling asleep. With the understanding of how much sleep, having your phone out before you sleep will actually result in you taking more time to fall asleep. Study participants who were using an e-reader before bed took on average 10 minutes longer to fall asleep versus those who are reading a normal print book. Phone activity before bed can also suppress your melatonin secretion when you need it most. The hormone melatonin plays a key role in maintaining a proper circadian rhythm and promoting deep restorative sleep. It may also play a role in protecting the healthier brain later on as you age. The light emitted from the phone shines directly into your eyes, suppressing the production of this crucial hormone in the evening. With the understanding of how much sleep each of us needs, we'll now take a look at what happens when we fail to get the recommended amount of sleep. Sleeping deprivation and oversleeping cause significant negative health effects on a person. According to medical doctors Watson and Sherney, sleep deprivation causes significant impairment of vital body functions. Lack of sleep negatively affects the central nervous system. It leads to a poor and short long-term memory, interferes with creativity, concentration, and problem-solving skills, and it also causes one to be quick-tempered, moody, and heightens anxiety and depression. Sleep deprivation weakens immunity and increases the risk of diabetes, high blood pressure, heart disease, and weight gain. Also, new studies have shown that without enough sleep, one can even be affected socially. Watson and Sherney demonstrate that a lack of sleep leads to a neurobehavioral phenotype of social withdrawal and loneliness, one that is often perceived by other members of society and reciprocally makes those societal members lonely in return. As human beings, we did not evolve to be alone. Sociality plays a fundamental part in the well-being of us as human beings. Conversely, social isolation and loneliness are known as risk factors for premature more so than being obese. Oversleeping also has negative effects on one's overall health. Oversleeping has been linked to chronic health conditions such as diabetes, obesity, and heart disease. Oversleeping is also associated with back pain, headaches, depression, and death. Now that we know the potential harm of too much and too little sleep, let us look at how we can improve the amount of sleep we get. Improving the amount of sleep one gets requires improving the sleep environment, changing behavior to facilitate sleeping, and engaging in active physical activities. According to a Better Sleep Council, getting healthy sleep requires the creation of a conducive environment for sleeping. Make the temperature, sounds, and lighting of the bedroom conducive for sleeping. Have a comfortable mattress and pillow to sleep on. Get rid of all electronics and other things that eat into sleeping time. Make behavioral changes to enhance adherence to the recommended range of sleep time. According to Harvard Health, one should create time during the day and on weekdays to repay sleep debt, to catch up on sleep. Stick to a sleep schedule to help optimize sleep time. Johns Hopkins Hospital recommends active physical exercise for better sleep. Exercise raises body temperature, which facilitates sleeping when it starts to fall. Exercise reduces stress and tires one out of making it likeness to have quality sleeps in the right duration. So far, we have discussed the amount of time that one should sleep, the negative effects of not getting the recommended amount of sleep, and how we can improve the amount of time we sleep. Sleep is a key determinant of our health and well-being. In order to optimize our abilities, attain our goals, and enjoy our achievements, we need to deliberately set aside time to sleep every day. In setting aside time to sleep, we have sufficient time and strength to accomplish more than we thought possible. The next time that you have a fast approaching deadline, try to set aside sufficient time for sleep and see how easier it will be to beat that deadline.